Welcome everyone to Montgomery County's Engage at Home, brought to you by the county's Caregiver Support Program. Today we have two guests with Seabury Care Management. I've asked them here today to tell us a little bit about their work and a special program that they have coming up. Christine, welcome, and would you please introduce yourself and tell us about the program?
Wonderful. Thank you, Lily, and thank you all for being here. We really appreciate being a part of this program. And again, we so benefit from the services that you all have to offer. As Lily mentioned, my name is Christine Bitzer. I'm the Assistant Director of Seabury's Care Management program. I'm a licensed clinical social worker, and I've worked in the field of aging and healthcare for the past 20 years. So it's been a little while. To tell you a little bit about Seabury Resources for Aging, of which care management is one of the programs, we were founded in 1924. Since then, we have really grown as an organization, and it has always been our mission to provide personalized, affordable services to the older adults and their caregivers within the DC metro area, including Montgomery County. Those programs include such things as senior housing, transportation, meals, care management. And in fact, that's one of the things that's the primary thing that Christina and I would like to talk about today. The care management program, of which, like I mentioned, I'm the assistant director. We've been around for 24 years now. So not quite the 96, but we're making our way. And our goal is to help our clients and the individuals who call us to maintain a high quality of life. We do this frequently through things like advocacy, counsel, support. Recently, in fact, I guess it was about 3 years ago now, in addition to our care management, we started a life enrichment service because we felt like that was such an important aspect. We also give back to the community quite a bit by reaching out to the larger. We have our information line where we talk through situations and provide resources and information. I've had the pleasure of being throughout Montgomery County and some of the senior center communities, the villages, just giving presentations and educating caregivers as well as older adults. One of the last things that we do is we also offer some support programs. And we're really excited today because we're launching a new program called Caring for Me, Caring for You. And I'm going to let Christina Bowen introduce herself as well as the program.
Thanks, Christine. As Christine said, I'm Christina Bowen, and I am also a consultant who works in the area of policy and implementation of systems change in long-term services and supports. But I also work with Seabury and do some of their caregiver support programs and am licensed in DC and Maryland as well. And we're really excited about this program that comes to us through the Roslyn Carter Institute for Caregivers. So Rosalynn Carter, First Lady Rosalynn Carter, when she left the White House, went back to Georgia and started this wonderful institute in 1987. And she's famously quoted as saying, there are 4 types of people in this world. People who have been caregivers, people who are currently caregivers, people who will be caregivers, and people who will need to be cared for. So that pretty much covers all of us, doesn't it? So Rosalynn Carter's been a fierce and vibrant advocate for caregivers, for family caregivers, and they have so many programs, many of which are evidence-based, meaning they've been tested, and this particular program is evidence-informed, and it's called Caring for You, Caring for Me. And what that means is that the program started over 20 years ago, but has been refined and improved based on feedback from the caregivers and professionals who have taken the program. So we're very excited to bring that here to Montgomery County and really to anyone beyond Montgomery County, since it's a virtual program, and that's one of the gifts of this pandemic, isn't it? So the primary focus of Roslyn Carter Institute is really on unpaid or informal caregivers. So what does that mean? So a lot of caregivers don't identify as caregivers, right? So, but if you're providing support like grocery shopping, running errands, helping someone with their prescriptions, running to the drugstore, cooking, cleaning, or providing any type of personal care, then you're a caregiver. And as I was prepping for this, I realized I'm a caregiver. So my dad moved in with us in April during the pandemic. He's 88 years old. He lives with my family and my husband and my 2 daughters. And so I'm squarely in that category too, and might not have identified that way. So that's one of the things that we'll talk about in the program is what is a caregiver, and we all have different roles as caregivers, and how can we learn from each other about those. So one of the interesting statistics that I think always catches my attention when I hear it is there's 41 million family caregivers across our country, and that equals up to about 34 billion hours of care. So that is a lot, and that translates into 450 billion, according to a report by AARP, of the economic value of that. So that's huge. And so our government, both federal and state and local, is recognizing that and realizing that to keep that going, especially during COVID when so many options are limited, we really need to support caregivers. And this program is one way that we at Seabury are offering to support caregivers in this time. So we really think that caregivers provide this tremendous value, and that there's also great value in kind of circling up with other people and talking about some of the joys and also the challenges that can come with that role. So oftentimes when we choose to become parents or we choose to take on a job that involves caregiving, it's an intentional choice, but many times family caregivers are kind of thrust into the role by some kind of a medical crisis or even with COVID, helping out our older relatives. So that's why we feel that this program will be really beneficial. So let me just tell you a little bit about the program. Basically, it's 5 sessions, 5 modules. So we'll start just in the middle of January, and every Tuesday we'll meet. So the first time we'll talk about what does it mean to be a caregiver. And this group is actually going to be open to people who are family caregivers as well as professional caregivers. So caregivers who are working in home care or in senior communities. The Institute really feels that this program can benefit from everyone sharing their insights and their different roles and their problem solving with each other. So that's a really unique thing about this program. The second session, we'll talk about taking care of yourself, this important thing that we all know we need to do, and sometimes we just forget to do that, or we need a little encouragement or creative brainstorming of how we can do that in the midst of COVID, when we might not be able to go to a gym, or we might not be able to take advantage of traditional respite options in caregiving. And then the third session, we'll talk about building cooperative relationships. So who is on your team? How can you build that kind of circle of support around you? And we'll help each other through that. And then the fourth session, we'll talk about problem solving. So there's these challenges that come up that we don't anticipate. Sometimes we get stuck or frozen, and brainstorming that as a group can be really helpful. And then finally, we'll talk about what are the resources out there. So you know about so many wonderful resources through Montgomery County, but we'll cover those, the resources paid, unpaid, and informal faith-based communities. So we'll kind of do brainstorming and come up with resources that will help the participants and whatever makeup the group has. So that is, in a nutshell, Lily, what the group will be doing. So
wow.
Happy to take questions.
Thank you so much. And I know that you've created a website for this series. So I will put that link in the description where people found this Engage at Home episode. So a quick question, what are you hoping folk will get out of it by being participants in it?
That's such a great question. I personally believe there's power in groups. So I think you could read a book about caregiving, you could read a blog, you could watch a video, but I think there's a real power in coming together with other people and sharing your story and getting insights and solutions and group problem solving. So I think that's what people could take away from this group. And it might not be, the ideas might not be rocket science. I mean, it might be things that you go, oh yeah, I forgot. I had that, tool in my toolbox. But through a group, we can remind each other to take advantage of those things that have worked for us before in the past.
This is going to be an amazing program, and I'm so glad that Seabury has taken the lead and are offering it, and I know that folk are going to get a lot out of it. So we're getting near the end of our time today, and I just want to circle back with both of you so you can share some closing thoughts with our audience. Christine, what are some thoughts that you'd like to leave our audience with?
Sure, thank you. I think I agree with Christina. I think it's very important for us to reach out, to come together and to ask questions and share our stories. Certainly, please feel free to give us a call. We're happy to talk through things. And just join us. Our website is SeaburyCareManagement.org, and we'll be happy to talk with you.
And you mentioned about your helpline, which I think sounds like something very valuable. Could you remind people of that phone number?
Thank you for that. It's 202-364-0020. So again, I think we can put this in the description, but it's 202-364-0020.
Yes, definitely. I'll put all of the contact details in the description. And, that's a really good reminder that, we want people to know that there are organisations out there like Seabury who are available. So, Christina, would you please share some closing thoughts?
Well, in closing, I would say this is the perfect group to circle up with in the winter months when it's a little bit cold and you might not want to circle up outside. So come join us, and we will problem solve together and support one another.
And one thing I'd like you just to remind folk, I'm assuming that all sessions will be done virtually, and you said they were going to be on Tuesdays. I don't know if I remember what time of the day they were.
Yes, they're Tuesdays from 2 to 3:30.
2 to 3:30. And what was the date that you said the sessions are starting?
It's going to start right after the Martin Luther King holiday, so January 19th, Tuesday, January 19th.
Wonderful. And as I mentioned, all of the details and the links so you can learn more, maybe make inquiries, they're going to be on the Engage at Home episode's description where you found us today. So Christine and Christina, Seabury, thank you so much. It's been a terrific honour and opportunity to be with you today and hear about this new program. The Roslyn Institute is highly respected, and the work that they're doing, which now you are going to be offering in Montgomery County, is a real treat. And folk are going to definitely come out of it enriched. As you said, Christina, they're going to have a few more tools in their toolkit.
Definitely.
Absolutely. Our pleasure, Lily. Thank you.
Yes, thank you so much.
Thank you.
Our honor as well.
So you have been watching Engage at Home. This episode is part of Montgomery County's Health and Human Services Area Agency on Aging. Please go well, stay healthy, and as always, be calm.